Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. Now to the most urgent. Today, May 5th, 2025. It's the date we expect the United States Congress to reconcile budgets. Both the House and Senate budgets have adopted drastic cuts to the Energy and Commerce Committee, which will result in serious losses to Medicaid funding. While we likely won't know the methods of how these cuts were carried out, stay tuned for an updated report in our news next week. On to the damage report. The number of hospital closures in 2025 has sadly risen to 15, which is more than half of the total hospital closures in the year 2024. Since our last update, we have seen more hospital closures in the United States. Pennsylvania-based Taylor Hospital shut down last week following a long struggle to sustain operations amid major financial challenges, which sadly ended in bankruptcy. According to a report from KFF, the ratio of hospital closures to hospital openings shows a much wider gap in rural areas than urban. Between 2017 and 2023, 61 rural hospitals have closed, compared to 11 new hospitals that opened, versus 87 closures in urban areas compared to 74 facility openings. Outside of the impact of potential Medicaid cuts, 432 rural hospitals are vulnerable to closure, according to a recent report from Chartis. A recent letter published by JAMA Network last month found that the United States will experience a severe shortage of beds by 2032, a trend that has been in motion since 2009. But even without taking Medicaid cuts into account, total annual hospitalizations are projected to increase even more significantly in the next 10 years. These shortages are attributed to aging populations, increasing patient volume, labor shortages, restricting capacities, and of course, ongoing financial struggles. All these reports are a reflection of the danger rural health is in as we look ahead to the next few years. For today's success story, we're celebrating National Nurses Week. Hillsdale Hospital is grateful for the nursing staff who care for our patients in our facility, as well as those serving patients across the areas of rural health in our country. We should always be thankful of our nurses, but this week specifically, we'll be appreciating them even more. Nurses Week first was recognized in 1954 to honor the 100th anniversary of Florence Nightingale's mission to Crimea. Despite numerous efforts to establish the week as a national tradition, none were successful until 1974, when the Council of Nurses proclaimed on May 12th as the National International Nurse Day, and a month later, the White House designated National Nurses Week. Help Hillsdale Hospital and other healthcare organizations across the country celebrate and recognize nurses this week for the wonderful and amazing care that they provide. Thank you to our sources for this episode: Becker's Hospital Review, KFF Health News, the Chartis Center for Rural Health, DC Report, the JAMA Network, and nursingworld.org.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.